that we don't have any issues with connection. My name is Zero Evlambidou. I'm one of the scientific coordinators of MediPIET. And today the meeting will be recorded. So we may be able to upload it in the website at a later point. We are waiting to see with the Go.Data team if we are able to do so. But in the meantime, we will be recording this video. But you don't give consent to for your voice to be recorded, then please use the raise hand feature. If you consent, then please raise the hand feature, and we will give you the floor for live questions at the end. If you prefer not to be recorded, then please type your question in the chat box, and the moderators will address the question to our speaker. So today's speaker is Dr. Lise Grout. Lise she is a vet epidemiologist and specialized in veterinarian public health with a Master of Public Health and 2 years of fellowship in the French FETP. She has worked for MSF and Epicenter in the emergency department before developing a portability surveillance system for homeless people in France. Since 2014, she has joined the World Health Organization, first as a junior professional officer, and then as a technical officer in the Department of Control of the Neglected Tropical Diseases, where she works as a data manager on strengthening data collection and use. For the last 2 months, she has been seconded to the Go.Data team in order to support the implementation of this tool for the COVID-19 response. And today she will give us an overview of the contact tracing strategies and how to use the Go.Data tool in the context of COVID. So I would like to welcome Lise and give her the floor for the webinar.
Thank you very much. Thank you very much for your interest in Go.Data and for inviting us to present in those MediPIET webinars. I had the chance to look at the previous webinar where you had a very interesting discussions with high-level professors, so very interesting. So thank you very much for having us part of those webinars. I will be presenting obviously on behalf of the Go.Data team. As you mentioned, I'm in the team for 2 months only, but I'm in the team as several years of experience now, and the tool is very nice and very well suited for the contact tracing, which is a very fashion topic right now when the countries are trying to go out of the lockdown situation. I'll have my presentation in kind of three different moments. I'll start by presenting some key concepts of the contact tracing strategies and where Go.Data fits in this landscape, because one tool can't do everything, obviously. So for you to have a better understanding of what where Go.Data fits in the landscape of contact tracing. Then I will go quickly through the capabilities of Go.Data before doing a very short demo, just for you to have a flavor of the tool and telling you where Go.Data is currently implemented for COVID-19 response. And finally, I will briefly give you some examples of complementary projects we are running with some universities in order to increase the use and the capacities of Go.Data. So if we start by a brief concepts about the contact tracing. So contact tracing is the process of identifying, assessing, and managing people who have been exposed to someone with COVID-19 to break chains of transmission and prevent onward transmission. So here there are many concepts which are very interesting. So the first thing is you need to be able to identify the cases, to be able to identify the contact of those cases, most probably, and then assess whether they are real contacts and are at risk of getting the infection. And then you need to manage those people. So we'll see that managing means several stuff. And the reason for doing that is really to break the chains of transmission. So the illustration on the bottom of the slide shows how the infection to COVID-19 virus maybe spreading very quickly in the population. So you see on the first group, you have one person who is infected by the virus and start getting sick. And suddenly, with the current statistic we have around the virus, suddenly you will have 3 people who may become sick among the contacts of that person. And if you let the infection goes, then from each of the 3 contacts who became ill, they may also infect 3 more contacts on their side. And that's why then you get this kind of exponential curve of the number of new cases. That's a scenario we've seen before countries started to lock down the population to be able to control the pandemic. So the idea of the contact tracing is kind of simple, is that if you manage to identify quickly a case, and then you manage to quickly identify the contacts, then what you should be doing to prevent, to break the chains of transmission, is to quarantine those contacts, be infectious or not, even more for COVID-19, because we now know that most probably cases start being infected before they're having symptoms. And then do a daily monitoring of the contacts for 14 days. If during those 14 days they start to have symptoms, then you may want to confirm them with a test and start looking at their own contacts. Hopefully, because they have been quarantining, they should not have that many contacts as the index case. The other ones, you may release them from the quarantine after the 14 days daily monitoring. And if you do that efficiently and in a timely manner, then you may hope that those 3 secondary cases will not have tertiary cases. So that's the concept. And there has been a guidance note who has been issued by WHO recently on the 10th of May, which really will give a very nice overview of contact tracing in the context of COVID-19. And I put the link here if you want to have a look at this interim guidance. But in the recent weeks, we've heard a lot about contact tracing and tools to be able to do contact tracing, and we realized that there were some confusion sometimes between the different concepts or strategies in doing contact tracing. So to us, there are 3 main categories of contact tracing. There is what we call in the team the traditional contact tracing, which is how you do contact tracing where healthcare workers or community health workers are responsible of identifying the contacts and following them, monitoring them for 14 days. That is what traditionally done in developing countries when there were a need during outbreaks to do contact tracing. You have community health workers which go and visit the contacts to monitor that they are not developing the symptoms. But very recently, in the last few weeks, there has been a lot of interest in what we call the proximity tracking apps, which are slightly different because here you are not relying on a healthcare worker to identify cases, but on technology, on Bluetooth technology and mobile applications. And the third big category of strategy is what we call the self-reporting, including SMS-based solutions, where what you ask is the individual itself to provide information on the daily symptoms or the temperature, which is also I mean, we see them all as very complementary, potentially, but slightly different. And I think it's important to make a slight difference. And the way they are different is in how they are identifying contacts and how they are doing the daily monitoring. So very quickly, I'll go first into the identification. So you have the contact definition on the guidance on contact tracing, and it relies mainly on the distance between you and a case during at least 15 minutes without having a good personal protection. So the idea is when you have a case, then you need to know who has been sitting in that distance for more than 15 minutes with the case. So in the traditional contact tracing, what you do is a case investigation. So you will have a health worker which will sit down with the case and try to see with him all the contacts he can remember from 2 days before he started to have the symptoms up to the moment they are asking, or 14 days after the onset of illness. While the proximity tracking app will just record all the smartphones you have been in contact with in the last 14 days and encrypt the code of those contacts. Turn out to be a case, then you will get notified. So you see the identification is very different. The thing is, with the proximity tracking, then you rely on the contact to be able to go back to the health system and say, I have been in contact potentially with someone who has been sick. I mentioned the strategies were also different in terms of daily monitoring. So when you do traditional contact tracing, the daily monitoring is usually direct monitoring, which means you again rely on a healthcare worker or community health worker who will visit the person, or for COVID-19, we mainly rely on phone calls to the status of the person and ask questions to make sure the contact is feeling well. While in the self-reporting tools, what you are doing for the daily monitoring is asking the person to self-monitor his symptoms. So he's not in contact daily with the health care worker, and only if he turns to report that he has symptoms, then he will be put in contact with health system. So that's to illustrate what are the key difference between those three main categories of what we call now, everybody called contact tracing. And again, in that WHO guidance, you will find some information to collect for the contacts. So where does Go.Data fits? Go.Data is a tool to be able to implement efficient traditional contact tracing and monitor the performance of that contact tracing. So that's why it was important for me to just briefly remind those three main categories. Go.Data is not doing proximity tracking. Go.Data is not enabling self-reporting. So it's mainly a tool for the healthcare workers, for the health system, to be able to, once a case has been identified, properly identify and record information on the contacts, and then do an efficient daily monitoring of those contacts. And we'll see that it also has powerful visualization features so that you can really have a good insight of your chains of transmissions. So that was the first part on the contact tracing strategies. I guess I will have all the questions at the end, unless you want to take some questions right now. What do you prefer?
No, I think it's better to have all the questions at the end, Lise.
Okay, very good. So I'm going now to the second part, which is going a little bit more into the tool. So I have a few slides, but I will mainly just go very quickly in the platform so that you have a look at what it is. Go.Data is a collaborative project coordinated by WHO and conducted in cooperation with the GOARN partners. So the GOARN is the Global Outbreak and Alert Response Network. So it has been started after the big in Western Africa, and the goal was really to design, develop, and deploy comprehensive software used globally by WHO member states and partners to support and facilitate outbreak investigation, including field data collection, contact tracing, and visualization of trends of transmission.
Este secția de supraveghere. Este secția de supraveghere și persoanele nominalizate pentru supraveghere. Toată informația e disponibilă acolo. Eu îți spun, tu îi spui nu, dar eu îți spun da. Toată informația în secția de supraveghere.
So, I don't know if it's possible to mute
Natalia,
No, don't worry. It's fine. It always happens. We are now used to these kind of things. Okay, so just to let you know that it's not supposed to be a routine surveillance tool. I mean, there are other tools which are very good and even better to do routine surveillance. Go.Data is really a tool to be deployed quickly when you have an outbreak and you need to do a good investigation, and even more if you are suspecting person-to-person transmission and then you want to be able to implement quickly a good contact tracing activity. It's a generic tool, so it is supposed to be used for any type of outbreak in any country. So you'll see that the platform is configurable, but by default, it's a tool which is agnostic of the disease and agnostic of the country. So I've summarized here the key features of Go.Data. You can find some documentation about Go.Data later. I will show you briefly those key features in the demo. So first, it's highly configurable. As I mentioned, it's a generic tool that you are supposed to be able to use for any type of outbreak in any country. So this implies obviously that you are able to customize the tool for a specific outbreak in a specific country. So you can control very finely the questions you want to ask for a specific outbreak, the location where the outbreak is happening to have a good geographical insight of the outbreak. You're also able to work on multiple operating systems, Windows, Mac, or Linux, and on the web interface or on a mobile app. It's also able to work online, but also offline, thanks to the mobile app. So the tool is really focusing on cases, lab and contact, plus contact follow-up. You can do that either manually through the web interface or through the mobile app. There is also a very nice capacity for huge file imports and a nice mapping widget from your Excel spreadsheet, for example, into the Go.Data. And the mobile app is also very well suited for the contact traces, so that they can very quickly input data on the cases and the contacts they are following up. But more interestingly, Go.Data offers a very performant contact follow-up. So once you have registered all your contacts with the date of last contact with a case, then Go.Data will help you generate the list of follow-ups for all the contacts that has to be followed up by the health workers in the next few days. And it will also generate dashboards which enable to monitor the performance of these contact tracing activities. So the drawing you see here, where on the right, where you have the names of all the contacts which are currently followed up, and then you have by day the color coding of whether in green the contact has been followed up and was okay, in red means it has been followed up and it was having symptoms, and in blue means it was not followed up, it was missed, while in gray is no data. So you see, you can in a quick look, you can really see how your contact tracing activity is going on, and identify very quickly also the contact which have presented symptoms during the daily monitoring and may therefore be converted into a case. And finally, there is also a very nice visualization tool. There is a dashboard which gives you some key statistics about your outbreak, the number of cases, the number of contacts, an epi curve, and so on. But more importantly, you have also very nice features for the chains of transmissions. And this is kind of very powerful to see and understand your outbreak. So if I just now go very quickly in the platform, I won't be able to do a full demo, obviously, because it requires some more time, but just for you to have a flavor. So you see here, I'm logging in to one of our training platforms. So the first thing is to notice is that it's a closed platform, right? Not everybody can enter into your platform. You have to be a user to be allowed to enter in Go.Data. So obviously to be able to protect the information. And then depending on your profile as a user, you will be allowed to see and do a different type of things. So you can really control what each of the to see and do in the platform. So I'll start with the dashboard. So this dashboard is just a key summary of the information guys when you are starting to enter data in the platform. So you can see very quickly grasp the number of cases and the distribution between the classification of cases and see, okay, here in that demo, so it's all fake data, it's a demo outbreak. I have 24 which are confirmed. I can see more or less the distribution in by geographic locations. I can see whether my cases are hospitalized or not. Then I can quickly go to the epidemiological curve where I'll be able to few days by classification. So I see in red my confirmed cases and in blue my probable cases, and I can change at the same outcome. This very nice feature, which is the contact follow-up. So for every day, and the line is the follow-up rate. So that I see whether my team is doing good, and in here I see my team has been improving in terms of performance in the contact tracing. And I have then very key performance indicators, both for the case, the contacts, and the chains of transmission, where I can see, okay, the number of cases who have died, for example, or the number of cases which have not been identified through contact tracing, but from another kind of case investigation. So that's kind of the summary you get. But to get that, then it means you have to input the data. So as I mentioned, the platform is very configurable. Here, for the sake of the presentation, I'm in English, but you see that you have many other languages, French, Portuguese, and Spanish, which are by default, and you can always configure new languages. Like here is Zulu, because we are having a training with colleagues from South Africa. At the same time, working on the demo, imagine that in a country you may have several outbreaks. In the menu here, you're controlling what you can do in the system. So what is below, what is above the gray line is real input of the outbreak of interest. What is below the gray line is more system administration. So let's say I want to enter and see the cases that I have in my COVID-19. All my cases, again, it's all fake cases. All the cases that have been entered in my platform. So I can see, I can search very quickly. I can order the cases by case ID, for example. I can filter by gender, for example, very quickly. I can also see some summary of information by the number of confirmed cases and number of probable cases. And I can very easily just add a new case. So here you enter in the case questionnaire. So in Go.Data, you have the specificity of Go.Data is that you have three tabs which are generic for all outbreak. We call them the core Go.Data variables. Whatever outbreak you are investigating, you may want to collect information on a person, on the address of that person, and some key epidemiological variables. So those ones will not change from one outbreak to the other. While the fourth tab, which is the questionnaire, will be the questionnaire specific to your outbreak. So those questions for now will be, for example, to the COVID-19 epidemic. So I will not go very deep into the questionnaire, but just for you to know here, and age and gender. Then you have the address, the place where the person lives, or you could also have the place where the person has been diagnosed. And then you have key for epidemiology, like whether the case is confirmed. And you finally have some information about key variables for the COVID-19. And what we have done is to develop some templates based on WHO recommendations so that the country can quickly use those templates to implement Go.Data for COVID-19. Once you have created your case, actually you can either do that manually, or you can also just import case data if you have all your cases for now in an Excel and you just want to import them all in the system. Once you have your cases in the system, then you can do something. You can create for each case, you can create exposure. So exposure means before the case developed the symptoms, to whom he has been exposed. This helps you building the chains of transmission. While contact is since he has started to have symptoms, or actually 2 days before he started to have symptoms, the people with whom he has been in contact with. And that will help you build the list of people, the list of contacts that you need to start following up. Here, you can also input some lab results for each of the case, so that you can link a lab result and then change the status of that person if the lab comes back positive. The lab results are then here. You have access to all the lab results. As you can see, I don't have the add button here because we don't want to add a lab result from nowhere. So each lab result has to be linked to a case, or in some countries where they are taking sample of non-symptomatic people, you can also have lab results from contacts. For the contacts, you can then, once they are all in the system, what you can do is to generate daily. So I've done that already for the last few days. So let's say for yesterday, here was the list of people that were supposed to be followed up by the team. So, and you see that they have done the follow-up for most of them, and they can be, they are either seen as okay, or they have been missed by the people. And you can filter, for example, to see the people who have been seen not okay. Well, it seems that yesterday everybody was okay, which is good. And you can do the same for some days and try to filter here. So I see here on the 18th, several people have been seen as not okay. For according is to monitor the performance of the contact tracing by going here through the dashboard. You see all people are under that, and you see whether the people have been managing to follow them up. If they are green, it means they are okay. And here I have an alert because that person may have presented some symptoms during the daily monitoring. Also, in order to be able to understand, and the thing I wanted to show to you is very nice sense of transmission. So, I mean, this is a very fancy feature of Go.Data, which really enables you to understand your epidemic. So you can have this kind of bubble network, but you can also have a kind of timeline network where you really understand the relation and the timing of your epidemic. Or you can have some hierarchical network like this one, where you see the primary, secondary, and tertiary cases. And then you can play a little bit with how you want to look at those things. For example, you want to see the gender and the occupation, maybe the IED, so that rather than the name, so that you can share that later with people. And here you see in blue the male, in pink the female, and here you identify very quickly the health workers in your chains of transmission. So obviously here I'm showing what you can do once you have your outbreak set up. There is some part of the system which you need to configure to be able to start doing that, but I will not be able to enter into this today. And you're welcome to learn more about it, and I will come back to that very soon. So as I mentioned, Go.Data started after the big outbreak of Ebola in 2014. It was first implemented during the recent Ebola outbreak in DRC in 2019, and then also used in refugee camps in Bangladesh. But there has been a boom, obviously, in the implementation of COVID-19, in the implementation of Go.Data since the start of COVID-19 response. Today, we have received more than 300 requests worldwide from 155 countries and territories since the beginning of the pandemic. And there is around 40 Go.Data installations, which are either fully up to speed or still at a piloting stage in all the WHO regions. And currently the team, the Go.Data team in WHO is working on helping countries for the ongoing rollout, having briefing and training sessions, and helping supporting countries during the configuration and implementation of Go.Data to improve the contact tracing activities. And I have just 2 slides for the last part of this presentation. So you've seen Go.Data has many very good features, and I reinforce the fact that it's really good for contact tracing and monitoring the performance of contact tracing and for visualization of the chains of transmission. But one tool can't fit all, right? So we know that Go.Data enters into an ecosystem. So working also on complementary projects where we can see how Go.Data can interact with other information systems which are better to do other things, and how also we can improve some analytical aspects of Go.Data. So one of the projects we're working on currently with the University of Oslo and the Polytechnic University of Catalonia and many other partners is the Go.Data interoperability, because many countries are implementing Go.Data specifically for the contact tracing capacities and the visualization of chains of transmission, but may have other tools for the routine surveillance system and the early warning. So we are working on to see how quickly, how easily the cases that are captured through another system can be pushed into Go.Data in order to perform the contact tracing with Go.Data. On the other side, if a country decides to use Go.Data specifically for the COVID-19 outbreak, it may have another national health information system where it wants to be able to display key summary indicators of the COVID-19 response. And so we are also working on pushing some key indicators from Go.Data into those national health information systems. Another work we are currently doing with several partners is to work on advanced data analysis. So the current visualization features on Go.Data are very nice and hard to replicate, actually. But it's not very flexible. So apart from the dashboards and the chains of transmission I showed to you, there is no real possibility to change the graphs or to add new statistics. So we know that this may be a limitation for some of our users. So the good thing is that Go.Data has a very good and large and robust REST API. So you can just extract through the API all the data you are collecting through Go.Data and then use that with any other statistical software. So we are currently working on building some advanced, some complementary dashboards. One which would be still more operational for the contact tracing monitoring, and one which may be more on the epidemiology and some advanced statistical analysis. So I'm reaching the end of my presentation. I hope I've not been too quick. Sometimes I'm speaking very quickly, but I'm happy to answer all your questions. Just for you to know, we see a big potential for all of you that during this COVID-19 or maybe later for another outbreak, be actually the implementers of Go.Data in your countries. So if you are interested in implementing Go.Data or learning more, the Go.Data team is working currently with ministries of health, member states, and public health institutions worldwide to support the rollout and implementation. There is an online course which is free on the Open WHO course that you can just go. It's currently in English and in Spanish. The French version is coming very soon. There is also further documentation, like a user manual and so on, that you can ask to be provided if you have a team and you have the email address here. And we will launch next week our community website, where we hope it will be easier then to interact from the Go.Data team with the users, but also within the community, and have a better network of supporters for the implementation of Go.Data during COVID-19 and after COVID-19. And I thank you very much for your interest in Go.Data. I hope that was interesting for you, and I'm very happy to welcome all your questions.
Great, Liz. Thank you very much. That was a very interesting and comprehensive presentation for this only half an hour. I understand that usually it takes much more to explain more about the tool. However, for me, it was a great introduction, and I'm becoming a big fan of Go.Data as I see more and more. Let's give the floor to our audience and see if anybody would like to ask a question. Anybody who would like to ask a live question? Okay, then maybe we can start with a question from the chat. Does this tool allow the mapping of the cases and contacts among the visualization features? So can we have a mapping of cases?
Yes, indeed. So in the Go.Data, you have something which you have to configure when you start using it, because again, it's generic for to be used by any country. So the first thing, one of the first thing you will have to configure is your geographical tree somehow. So here it's a training platform. So you see we have many countries, included a country which is called country, which is the one we use here for the demo. And so you have to build your geographical information from the country, the level 0, to the maybe region level 1, and then district, and then as low as you can. If you manage to put coordinates at the lowest level of your tree, be the coordinates of a city or the centroid of a district, then every time you record a case or a contact from that place, Go.Data will take that latitude and longitude and apply it for that case and contact. So you can also capture exact coordinates of the cases and contacts through the mobile app if you are visiting the cases. And that allows you to, through the menu, you have here a map, which helps you plotting all the cases on a map.
I see. This is very, very interesting for visualization. So I guess all the shape files of the countries and the different admin levels are already integrated into Go.Data.
Well, they are not already integrated, but you have to do that when you start configuring your platform. So that's one of the things we teach to countries who wants to implement Go.Data. What the first session of the training is actually partly on how do you create your location tree from your country, and we can use existing shapefiles, for example, or existing system for the countries who are using, for example, DHIS2 to collect their routine data. Then we can use those other information to be able to create the location tree for that country. And once this is done, then they can use that to capture the coordinates of their cases and contacts.
Fantastic. Is there anybody who would like to ask a question live now? Then maybe we can, I have a question actually. How easy is it to integrate the tool into the existing systems of the Ministries of Health or the Public Health Institutes in terms of, servers, privacy, and these kinds of
So it depends on several stuff. It depends on the capacity of the country. Obviously, for some countries, it's easier because they have already a good infrastructure. For some countries who are not able to have a secure server to host Go.Data, WHO also provides as a service to host the Go.Data platform for the countries, but then we don't access the data. It's just a service that we provide to the countries. And then, so usually it takes, I mean, it's kind of very quick to install the platform on a server. For some countries which have a very high level of data security in their policy, it has taken a little bit more time to make sure it copes with all the rules. And we are currently working actually with the University of Catalonia, the Polytechnic University of Catalonia, in a better way of anonymizing the case and contact information. Currently, if you are a user authorized to access this platform, you will have access to you see here the name of the case and some of the information. So what we are trying to do is to get the identification done outside of the Go.Data and have in Go.Data only anonymized information. This is not yet the case, but as soon as your server is protected and follow the good practices of informatics, then it's kind of very quick to install Go.Data.
Great, thank you very much. We'll move now to some other questions that we see in the chat. Adela Paeth, which is the other scientific coordinator, will help us with addressing these questions to you, Lise. Over to you, Adela.
Good afternoon to everyone. It's Adela. So the next question is, can you confirm whether we can access Go.Data and install it without contacting a WHO country office?
Yeah, so indeed, I mean, the Go.Data software is free to use. So to get it, you can request it to Go.Data team, and after a small assessment, we will share with you the installation files. So anybody actually can install it. I have it on my computer, for example. The thing is that what we try to do is to coordinate the effort in a country to avoid having 10 installations of Go.Data that doesn't speak one with each other. So when we receive requests from a specific country, we always inform our focal points in the regional office and in the country office of the World Health Organization, so that they can make sure they are aware of that and they are letting the Ministry of Health knows that there are people interested in using Go.Data. So that we try to coordinate the efforts and if possible, to make people work on the same installation, or at least to share the same questionnaire, so that later on it's easier to share the data and consolidate the data. But there is nothing which forbids to have several installations. In some countries, mainly in federal states, for example, you may have many installations for the different admin 1 level. And we also provide that as a service for the hospitals who request it for their own personnel. So in some countries, you have several installations at the hospital level, and then installation at the admin 1 level, and then a last installation at the country level.
Excellent. The next question is, how much time in average take to fill the information on the follow-up of a contact? Is that quick?
Even more, I would say even more on the mobile app. I mean, on the web interface, it takes you a few clicks, right? You have to come here and there and then find the right daily follow-up and then the right date. And so it takes a few clicks. It's still very quick also because our questionnaire is kind of very small. So it's not that we are asking thousands of questions, right? We just want to make sure the person is well. When I'm speaking, I'm just showing you how quickly you go. So for example, I want to do this one that now I've seen. And the questionnaire you see is not many questions, so it can go quickly. But I would say it goes even more quickly with the mobile app, because the mobile app is really designed for contact tracers. So in very few clicks on your smartphone or your tablets, you access your contact. On the mobile app, you have also a restriction of the visibility of the cases and contacts by, we have a concept of teams. So you can assign some teams to a specific geographical area, so that the contact tracer will see only the cases and the contact in that area, and only the ones that has to be followed up today. And so then it becomes very quick to just enter the data for the follow-up of those contacts.
That sounds very useful. And the next question is, could you quickly, so you already mentioned that the data can be exported, either an Excel file or other formats. Can you show quickly how to do that?
Yeah. So you see in the menu, you have these places where you go for where you're interested in the case data. And then here in the quick action, you can just come here and export case data. Then you can choose whatever format fits you better, and you can encrypt the data because it's case data, right? So you can encrypt your file. You can also choose to anonymize, so not to export some part of the information. For example, the name information, you may not want to export that thing. And then you just click on export and it's done. And if you have applied a filter before, let's say, for example, I have only my confirmed cases. If I now do the same export, then I will just have this subset of information which will be exported. So it really takes a few seconds if you want to export your cases in those formats and just have it here on hand as an Excel and work on that outside of your Go.Data.
Okay, thank you very much. There is a comment, actually, is congratulations to you, I guess, to Go.Data, because it mentions that it is a very flexible tool that allows to integrate all data without a new data entry of cases. And next question is, which are the categories of the variable status for contacts?
So it's very good. So we have predefined some options, and we control that through something which is called reference data, where you have here actually all the options of the drop-down menus, where you can control what you want to see. So here, for example, it's the case status, where you have confirmed, suspected, probable, and someone here in the training have created confirmed asymptomatic, for example, because I mean we are running a training this week, so they have played with this one. And for the daily follow-up status, we have this one, whether it has been seen and it was okay, seen not okay, whether it has been missed, or whether the person has not attempted to go there. But this is flexible. I mean, among the capacity for configurability of Go.Data, what you can do here is you can change. For example, I go to occupation also. If you don't like the list of occupation that we have put here because it doesn't have sense in your country to have hunter, then you can just delete that one, rename another, put a icon that you like, put another color. So it's very flexible again to fit your needs.
Oh, yeah, that sounds very good. Do you have time still for a last question, maybe?
Very happy. Yeah.
So my question is, if, for example, instead of contacts actually, or you have a potential exposure, like is happening now in South Korea with these COVID outbreaks related to visits to nightclubs, how would you include that in the system? I guess that would be an event.
Exactly. Very good question and very good answer. So I didn't take the time to go through that because we were limited, but I can very quickly show. So we have the cases and the contact, which are real people that we have identified with a name, right? But indeed, sometimes you don't know exactly to which contact, to which case the contact has been exposed. You just know he has been in a place where he might have been exposed. So here you can just create a new event, or I mean the event can be a place, or I don't know, a conference or something like this. You put the date where it happens, so it can be a period, but here it's the date where the events happened, the date where you were reported that the event happened, and you can put some description here, free text. Very importantly, you can also map that information to be able also to represent those events plot those events into the map. And here you are. So now you have a new event in your system. And this event, you can then add contact to the event, either one by one, or you can do a bulk add contact where you have this kind of table where you can go ahead and create one by one all your contacts, all the people who have gone to that event and have to be now followed up for a few days. And you will be able to visualize them. I think we have in those chains of transmission, and you see what is purple here are actually the events. So here it's a funeral. Here you have a musical concert, and you can link your cases, but also link your contacts with those events.
Wow, that looks amazing. Thank you very much. So we have maybe a last question by Angeliki.
Hi, Liz. Thank you. I am the third scientific coordinator of MediPIET. Thank you for the presentation. You did not only give us a flavor, but I think you gave us an appetizer. So we're looking forward. We are looking forward for the main dish. What I wanted to ask you is really brief and just for information for all the countries and the participants that they are attending the webinar is that you mentioned that once the country or a professional requests the installation of Go.Data in the country or its laptop or whatever, you can organize trainings. Excuse me. Can you tell us what is the duration of the initial training and if you can have multiple participants in that?
Yeah, very good question. So currently the different type of training we offer. One is we encourage really people to do the OpenWH online course because this one is free. You connect to internet from anywhere, and at least you have several modules to better understand what Go.Data is. Then we have regular 1.5 briefings. So it's the kind of demo I've done here, but having a little bit more time to go one by one through the different menu and have more time for the question and answers. So this happens, we have 2 sessions in French, 2 sessions in English, and soon 2 sessions in Spanish every week. We have just regular schedules. Before it was really on demand, but because the demand was too much, now we try to group them on the same schedule. And finally, we have virtual training. So the virtual training, 3 sessions of 3 to 4 hours, Monday, Wednesday, and Friday, where we go through the configuration of the system 1, then 2 is about the cases in the lab, and the data is about the contact and contact follow-up. And this, for the last 2 weeks, now we will open, it will run every week. So every week we have a session, 1 week is in English and 1 week is in French. So that for now, we prioritize the ministries of health, the National Public Health Institutes, or the partners who are really willing to implement, right? Those trainings are made for super users or trainers for the countries which will implement the tool. Later on, we will probably open those training to a larger community, to people who are just interested in the tool. But for now, because of the limited capacity, if a country is interested, it should contact the Go.Data team. We will then put them in contact with our regional offices, assess the needs, and then they will be able to access those weekly trainings on the system.
Thank you very much, Liz. That was very informative. Thank you again for your presentation. Thank you.
Thank you. Thank you very much for your interest. Very happy to be invited in this network.
We have a last question, if that is possible, in the chat. So the question is, if in a region you have 3 provinces and 3 teams of contact tracers, it is possible that the team of province 1 enter the information of contacts in another province? Or is any restrictions?
So on the web interface, that will be possible. You will be able to enter information for another province. On the mobile app, you will be restricted to your province. So when I say that, it will be, so when you will create your case or your contact, you see you enter an address. So it can be an address or a place of containment or a place of diagnosis, whatever you want to put there as an address. And so the restriction of access will be based on that. So if I'm a team on the province A, I will see only the cases and contacts which falls under the province A on my mobile app. I won't be able to see the rest, so I won't be able to change the data for the rest of the contact and the cases.
Okay, that was very clear. Thank you.
Thank you.
I think we don't have any more questions coming from the chat. I would also like to thank you very much, Lise, for your time and for the interesting presentation.
Thank you.
And I will give the floor to close this webinar to Alicia Padron Monedero, that is a doctor in preventing medicine and public health and the program director at the National School of Public Health at the Instituto de Salud Carlos III in Spain. So the floor is on you, Alicia, to close this webinar. Thanks to everybody for their participation.
Thank you very much, Hiro. On behalf of the Instituto de Salud Carlos III and the CDC, who held the scientific leadership of the project, thank you very much, Dr. Lise Grout, for this excellent webinar. Thank you very much. And of course, thank you to all our scientific coordinations, the three of us, and the rest of our team from the MediPIET project, whose work has made possible this webinar. As you all know, this webinar is one among all the scientific activities of the MediPIET project under the current COVID situation that we are all. And of course, as you know, the MediPIET is a project financed by the EU, DG DEFCO, and with the collaboration of DG Jante and the Joint Research Council. And yes, no more to say. Regards to all participants, all fellows, supervisors, and the Institutes of Public Health of the EU, and to the Commission. And see you all again on the next webinar. Thank you very much.
So this is the end. Have a nice afternoon to everybody and enjoy the spring.
Very much.
Bye.
Sure.
Bye. Thank you.